Very good evening to all of you. It's my humble introduction as before, working academically as associate professor in the Department of Medicine, but my fascination, my passion, mission, vision, most of the time in the family medicine. And this is my pleasure to introduce. This is our institute, and hope that most of you. Other colleagues are joining, I hope, within a few minutes, but we like to start in time. For that, we started already. And today, our topic will be anger management. Before going to the case, we need to know some basic informations. We invited here today to the GP, that means a family physician, as well as doctors who are preparing for the PACES exam. Interestingly, in PACES 2023, the communication station is almost, I like to say 100% near about as the OSCE exam stations. This is 10 minutes time. And before in the PACES, the examiner crossing was not there, was there before, sorry. But in PACES 2023 diet, that means the third diet of the year, the all communication station will be of 10 minutes time, like exactly OSCE station. So little difference is there that the GP is a GP. That means you are dealing a patient in the communication station as you are alone in your chamber. You are not sitting inside a hospital arrangement. But for the PACES situation, the doctors are usually senior house officer, a mid-level specialist. So those specialists have some support system within the hospital. So these are the difference in the setup, and topic will be that patient will be usually in the hospitalized patient or in the outdoor patient. But immediately from the outdoor patient, if you want to advise hospitalization, you can do, and immediately you can take action. So today, though, we will be focusing more for the OSCE preparation as a GP, but those who are attending as a candidate for the PACES exam, especially for the PACES 2023, definitely they will get the benefit. And we will try our best to describe the basics of anger management. You know that your station will be of 10-minute time, and after 8 minutes, you will hear 2 minutes left, and you have to finish last 2 minutes within 2 minutes. Before the scenario I will show, I like to hear from you. Anyone can share that in your life experience, in your practice, what type of anger you faced before, maybe from the patient or maybe from the patient's relative or other attendant. Can anybody share your experience, doctor? Just to understand what is the reality of our practice. Please, anyone? You can unmute by yourself, doctor. If you cannot share, the session will not be too much interactive and what I say, useful to you. We like to discuss something about in our real life. Please, anyone?
Sir, most of the patient says that the medicine doesn't work you given.
So this is the matter of the anger.
Yeah, they frustrated because they come for the second time and they say that the medicine are not working and I'm still suffering from the any condition. So sometimes they irritate.
So the reason of anger is not getting early relief. So
Sir,
how did you face it? How did you manage it? In short, very shortly.
sir, we will ask the question regarding compliance of medicine. He is taking properly or not, first of all.
Okay.
And what is the way he's taking. So these are the question. And second thing that there are if he or she taking well, then we will think about another antibiotic or another medicine.
Okay. So these are not very too much hard situation to face with. Thank you, Dr. Khan. Anyway, any other colleague, please? Just share a few of your experience. Dr.
Yes, sir. I
Fauzia,
have an
yeah,
experience.
please.
Uh, Actually, I work in a corporate, and the employees has the facility of panel hospitals and the consultants. So most of the patients wants to get more and more labs that can be done and want the letter of the specialist, and the GP should not treat their illness, and they want that they should get consultant letter or
Okay.
hospital admissions or more labs and all the screening tests like this. So they fight that it's their need, and why are you not giving me the letter or like this.
Yes, this is one of the type that they want the what I say irrationally the what I say better treatment facilities irrationally rather to say. Okay,
Yeah.
okay. Any other experience? Anyone? Please take your time to discuss. We will try our best. And these are the scenarios will be happening, possibility in your exam. Those are the real life situations are there. Please, anyone can share more? If no more, I can tell, but we like to hear from you. Anyway, most of you may be willing to be a listener more anyway. So what the last few years in the OSCE exam, whatever you say in the PACES exam, the scenarios are mainly like that. The wrong treatment. One colleague said that maybe inappropriate treatment, inadequate treatment, but in the patient's understanding, this was a wrong treatment. So wrong treatment may be really a scenario that it could be wrong treatment, but from the patient's understanding, it may be wrong understanding. Treatment was not wrong, but the disease course is like that patient is not getting better early according to the expectation of the patient. So drug-related situations are more. Whatever you said, Dr. Khan also said that the treatment-related situations are more. Sometimes drug adverse effect is there, not the outcome of the treatment. That now the drug effect could be side effect, could be even the anaphylactic reaction. Side effects I'm telling in common word. Anaphylaxis is also a side effect, very severe side effect. So unpredictable outcome of the drug treatment. And we need to face, and this unpredicted drug effect is common case for the OSCE as well as PACES exam. Another one could be consultation delay, and usually it is common in the OSCE exam more that the attendant, that means the helping person with you, who is dealing the serial number of the patient or patient relative complain against that person. It may be rational, it may be irrational, and most of the time your experience is saying that it is irrational. People like to break the queue, serial number, they want to see you very early. And there may be the reason that patient thinking the patient is very emergency in their understanding, but actually in context of the health, it's not emergency at all. Just patient is hurried to see you, patient is thinking something serious, maybe like that. The next point could be the delayed diagnosis of the malignant or moribund disease. For example, multiple myeloma is a malignant disease, the hematologic malignancy. Interestingly, patient present with the bone pain for the long time. Doctor gives the treatment for the painkillers and others. May not be thinking early that it could be a malignant disease because the fluid features of the malignancy is not apparent in the early time. So it took long time, maybe 6 months, 7 months later on, bone marrow study done and revealed that it is a malignancy. It is a multiple myeloma. So patient may be angry and patient may like to sue against you in the court. And definitely it is a cancer patient. Why doctors are delayed? So we should have a rational approach to the patient. We need to feel sorry and others, though I will show you a step by step later on. And we need to explain that the disease process is like that. And sometimes the patients are not coming in time in the chamber. There are many logics are there. So if I don't like to, actually, I don't like to discuss case by case everyone, but in general, I'm touching something. So one is the malignant disease, another could be another moribund disease, chronic debilitating disease, maybe multiple sclerosis. And those who know about the diagnosis of the multiple sclerosis is not easy in the early time. The clinical features are not much, what I say, calculative one like any other cases in the neurology. So sometimes the diagnosis of the multiple sclerosis also will be delayed. So in this case, how I am dealing with the patient with empathy, sympathy, with rationality, everything will be tested in the station of the anger management of the patient. And I mentioned you before that the angry people will be patient, himself or herself. Another will be maybe a relative. Another will be maybe a relative. And I believe that all of you almost have faced in your life minimum few cases, though you are not very feeling free to disclose it. I don't know how did you do in your life. Anyway, our topic today actually to discuss you the basic principles of dealing an angry patient. And it will be helpful not only for managing a patient or patient's relative, rather in our day-to-day life also, how we are dealing an angry person beside. And you know that the very nearest, dearest one might be angry to you, and how you are dealing. Usually it is said that when a person become angry, you have to be very quiet and calm. Anyway, so follow my animation, please. First of all, verify the anger. Actually, the person is angry or not. Sometimes the person becoming, the people are doing fun also. And within few seconds, we understand that this is a simple fun, not really patient, or some person is angry. So verify anger. Second, whenever you understood that the person is angry, you will be quiet and calm and talk very friendly and relatively in a low voice than the person. And most of the time, angry person talks in very loud voice. Very rarely somebody become angry with talking with very low voice. Most of the time, they're in the loud voice. So your voice will be lower, a little lower, but not too much low that in the exam hall, your examiner cannot hear you. It is a technical thing. So your voice will be relatively lower. Okay, then what you will do? You will continue listening. Continue listening means I can recall when I actually attend a session as a mentor or a speaker of basic principles of consultation. One principle is called the active listening. Active listening. Can anybody say what is the meaning of active listening, please? Anyone? Active listening means? Why not, Dr. Fauzia?
Sir, I think let him or her talk, do not interrupt, and listen attentively.
Anything more also? We have to say that, okay, good. Please carry on. Use some encouraging words. Can you remember, Dr. Fauzia now?
Yes.
Okay, good, Mr.
Okay.
Hassan. Carry on. Please tell me more. So
Please
we are
tell me more.
listening, we're encouraging. This is called active listening. But in the angry patient, it will not be active listening. All of you understood why not active listening, that we are not allowing the person to talk more continuously. Usually an angry people is irrational in his or her talk. So we will be very silent listener. But now the question is, how many seconds and how many minutes we will be listening? Dr. Fauzia.
Sir, I think 1 or 2 minutes.
In the exam hall, usually 1 minute, 1.5 minutes, at best 2 minutes, but not more than 2 minutes. A thing is that if you try or anybody try, after becoming angry loudly, if you want to continue talk, you cannot talk more than 1 minute or 1.5 minutes. You can try. Okay.
Right.
Or somebody become angry talking to you, but you are not talking anymore. You will find that the person beside you become quiet and calm after 1 or 2 minutes. This is very, very natural. But if you interrupt in between, you will also shout in between, and usually we do it. It's not it, Dr. Fauzi? Usually we
Yes,
do it.
sir.
Usually we do it. And person is
Difficult.
continuously 5 minutes, 10 minutes. Maybe there may be some physical, what I say, manipulation also. Unfortunately, it happened. So the basic rule of managing anger is passively listening continuously. The philosophy underlying is that when a person become angry, actually they try to exert the anger upon your shoulder to get relief. At that time, patient become irrational. So better to listen, absorb the anger of the person. So 1.5 minutes like that. In between, you can say, have your seat. Means if the person is shouting by standing, you have to say that, please have your seat. I am sorry for that. Only 2 things rather. Have your seat. I am sorry for you. Maybe person is irrational, illogical. Even then, I have to feel sorry. Why? Because somehow he's embarrassed. There is no confusion. Rightly, wrongly, the person is embarrassed. So I, as a professional, my courtesy is to feel sorry for inconvenience happened to him or her. Okay. But don't talk more. If the person complain against any person, maybe your staff, your nurse or brother, or any person in the institute you are working with, don't take the side. For example, somebody blaming your attendant that I told you that maybe problem in the managing the queues, serial number, and patient is talking against him or her, but you are also telling to make your patient relaxed, falsely though. Yeah, this outside guy is very naughty, he's very bad man. I like to kick him tomorrow. But what is the rationality? It is prohibited. It is prohibited. And we have to be very neutral. We can say, okay, I will look after the issue. Don't worry. Up to that. So don't take side. Maybe in the patient side or maybe in your staff also. Okay. If anything happened wrong, genuinely, definitely I will apologize for the mistake done by myself or my staff. Because we are working in a team, though it may be a very small team in the general practice situation, but in the hospital, it will be very big team. So on behalf of any member of the team, I must feel sorry for these happenings and I will apologize for the mistake. Try to remember this, doctor, and try to explore the contributing factor for the mishap or the mistake, if possible, in the talk. Okay. Then finally, if the person or the patient is rational, accept his logic and acknowledge his reason and appreciate that he actually identified the mistake. Okay. And immediately, if you can give some solution, you can give the solution to the person. And we can discuss later also, if possible, after the case practice, that what could be very, very silly and minor issues, and we can give the solution also. If in time allows us, I can give you some scenarios later. Some scenarios actually, rather to say, not detailed, just one problem and one solution I will discuss later. And after giving the solution, if you don't have time, you can reschedule the main issues. Actually, person is here, may be busy with this thing, what made him angry, maybe queue problem or other problem, but actually patient might have any physical illness to talk about, but your time is over. So you can reschedule this thing. But if it is emergency, you need to tackle it within very short time. It depends upon the situation with you at your hand. And it is not regularly happening, every day happening, occasionally it is happening. Okay, sorry. So in these steps, when you will go there, the don't take side, feel sorry, continue listening. After patient become quiet and calm, when you say that, have your seat, usually first time the person or patient may not take sit. Second time again, please have your seat. And what will be the distance between you and the person or the patient? What the distance? Usually more than 1 meter, so that the person hand cannot touch your body. Okay, sometimes angry, I told you, you know, that the person become irrational at this time, 1 or 2 minutes. So maintain a safe distance from the person. And in the exam also, actually, you need to show your body language also. Sorry, I cannot show you now in this session. If you want, we can make arrangement of the video consultation another time for another issues, especially the breaking bad news and the angry patient management. Body language of the doctor is also important. And how to stand in front of the patient. If patient actually is standing, you will not be remaining in the sitting situation on the chair. You need to stand up. When patient took the seat, then you will take your seat. And when you stand, you just cross your hand in front of you or interdigitate your fingers. This is a general norms of standing in front of any person in front. Is a very gentle attitude. Okay, so these are the things we explored actually in our research in the last few years, how to tackle the angry patient or angry relative. Now, we'd like to show you one case. So today, who will be volunteer today before showing the case? Anyone? Especially those who are preparing for the OSCE exam. Please, anyone to be volunteer? It will be better for you. Some of you may be preparing for the Chennai. Feeling shy or like, okay, I will show you the case. No worry. Eh? Whatever the case, your basic qualities are tested more, not the topic more. The principles of managing the angry patient or angry relative. Please look at, I am reading out for you. The patient is Mr. Jaydan Hassan, aged 34 years, but you will be talking to brother. Brother is Mr. Allawi Karim. Allawi Karim is waiting to talk to you. And during talk to other third person, there was a requirement of the permission. Okay, the consent is important. Legal issues that on behalf of the patient, somebody might be talking to you, but we need to get to know that the person have permission from the patient. So in the exam hall, usually it is written as assume that the brother got permission from the patient in general. Otherwise, you can say in the exam hall also, sir, does Mr. Allawi Karim has permission to talk on behalf of patient? It was a very intelligent interaction with examiner if it is not there. But usually it is given because it will waste the time. So look at that. Mr. Hassan was treated by you 3 days before in your chamber, in your surgery, with the MRCP for community-acquired pneumonia. 3 days before. Now today, Mr. Karim, his brother, is here to talk about the outcome of the treatment. Proceed with consultation with the brother and make a management plan. So where is the issues of the anger here? Can anybody say what could be the reason of anger here? I think Dr. Khan said that the patient is not getting better in these 3 days. Dr. Khan, please, where are you? Can you raise your hand or can you unmute? Yeah, Dr. Khan. Maybe your scenario like that. You have given amoxicillin, patient, the brother is not getting better in expected time. Okay, Dr. Khan?
Yes, sir.
Any other possibilities other than this? Can anybody guess also? Dr. Farhad here?
Sir,
Yeah, please.
maybe, sir, due to penicillin allergy can be there.
Penicillin allergy, maybe drug reaction. Drug reaction, okay, could be. Very good. Any other reason? Reason may not be only single one. There may be more than one reason also. Because patient is waiting outside, entering your chamber. Patient will be talking to you. Anyway, we don't know. Suppose we don't know, or maybe drug inefficiency, or maybe drug reaction. But how to start with, it is important. Those who didn't attend any anger management station, I hope you will get the most benefit today. So please, all of you become ready to enjoy the anger management station. So timing will be 10 minutes. Who will be here? Sorry to hear. Anyone to be volunteer? Still not ready.
Hello, I can.
Yeah, Dr. Faisal.
Yes.
Did you practice angry patient management before?
This is purpose.
Did you attend anytime, anywhere?
Yeah.
Fantastic. So take a deep breath, and I am taking my deep breath also to surrogate you today. Okay.
Okay.
And other colleagues are requested to note down if anything wrong in your sense. We can discuss or correct ourselves if anything happened wrong by ourselves. So Dr. Faisal is here with us. It's very nice, Dr. Faisal, with you. So you know that usually in the station it is said, how? Enter please. Enter please. Then you will enter. Then it will be, and you know how to start with good morning, good evening, right, Dr. Faisal?
Yeah. Yeah.
Okay, let us see. Enter please.
Okay. Hello, I am Dr. Faisal, one of the PACES candidate here today.
Sorry, Dr. Faisal. Dr. Faisal, BGP, not PACES today.
Oh, okay. Actually, here
Repeat,
is
repeat.
not my designation is not mentioned.
I told you
Okay,
it is a setup for the GP. Setup for the GP. So
Sorry,
think that you are a GP singly practicing in a GP center. Okay.
Okay.
Enter please.
Hello, I am Dr. Faisal. I am the GP here today.
Yeah, doctor. You are Dr. Faisal. I know you, doctor. I was there 3 days before. No need to introduce myself, doctor.
Okay, nice to see you again.
What nice, doctor? Everything is very bad, doctor. You are telling nice means? Oh my God, doctor. I was here with my brother and he's going to die. But you are telling nice, doctor?
Okay, so sorry to hear that. Please tell me more about it.
What I like to tell, doctor. I already told. My brother is going to die. And you the person. You the culprit, doctor. You're killing my brother. 3 days over, doctor. What can I do now, doctor? Please. Why you have done it, doctor?
I am really sorry for your brother, and I appreciate your anger. And I really feel I am really sorry that you feel like that. Would you please tell me in your word what's happened?
Doctor, you have given my brother treatment for, you said that he was having pneumonia, bug in his chest. And you have given the medicine, doctor. And I can remember that was amoxiclav. But doctor, from last night, he has some rash, doctor, in the skin, and he's aware of the rash, and he's thinking that something happened very dangerous, doctor. He's going to die now, doctor. Please do something. Please do something. But why you have given the medicine, doctor?
Okay, Mr. Karim, I totally understand and appreciate your anger and concern about your brother. I do apologize for what happened to your brother. So what's happening? Would you like me to explain what could be the possible reason for this?
Doctor, how can I say you? It is a drug. Maybe the drug is not working. Medicine is not working, doctor. Having some reaction. It is very dangerous, doctor. The medicine reaction means very dangerous.
Yeah, I appreciate your concern. And that's true. That could be a possibility that drug reaction has happened. That's why your brother having this problem. And I'm really sorry for that. It's happened to your brother. I can see you really love your brother. You care for him. That's highly appreciated things. But please take, I am sorry that what happened. It's nothing intentional at all. So actually, your brother came to me 3 days before with a problem with some fever, which we subsequently diagnosed as pneumonia. Am I right?
I can remember,
Yeah.
doctor.
Yeah. After that, for your brother betterment, I prescribed the best available treatment according to our guidelines, which meant to be for the patient for first line therapy. So as this MRCP is the best in the best interest of your brother condition. But what I came to know, unfortunately, a reaction has happened. According to is it in that high yesterday, right? And
Yeah,
he
doctor,
has
yesterday
some.
it happened, doctor. What happened is very dangerous, doctor, for my brother now.
Okay. So may I ask, where is your brother now?
He's at home, doctor, now.
Okay. Oh, other than rash, could you tell me what other symptoms he has shown?
Other symptom is, doctor, what would you like to know?
Any others like any fever, shortness of breath,
No, doctor, he
difficulty in
was having
breathing?
fever 3 days before. His fever was less now. And he was having cough with flame also. It is also less. But
Okay.
he developed this, doctor. The red skin become red, and there is some the pimple like things, doctor, appeared.
And is it the pimples like appear all over the body
Yeah,
or any
doctor.
particular site?
No,
Hey,
doctor.
hello,
Yeah,
sorry.
doctor. All over the body,
Yeah,
doctor.
all over the body. So, Mr. Karim, why don't you bring your brother along with you?
Doctor, I'm afraid, doctor, he's lying on the bed. He's also afraid to come out.
Yeah, I
He's
really
feeling that
afraid.
he's going to die now, doctor. I want to listen from you, doctor. Why did you give the medicine? You told me it is the best medicine, but the best medicine is the medicine who is killing a person, doctor. I don't understand
I,
now.
I understand. I am really sorry you think like that. But I can assure you, Mr. Karim, the medicine have been prescribed, which is in the best interest of your brother condition. Most of the patient get usually better with this medicine. Only few, as all medication, some sort of reactions. Yeah, there is a less chance, but still there is a chance that there is some adverse drug reaction or something like that. And
It
I'm
means,
really sorry
doctor,
for
it
that.
means, doctor, that my brother is going to die right now.
Well, it's very difficult to say like that because I haven't seen your brother now. But at the same time, you mentioned that your brother fever has subsided, cough and phlegm is also decreased, which actually is a good thing. That means it really works. But what I need to know why this happened, we need to figure out. So for that, I think this is the best way if you bring your brother here so that we can examine him, assess him for what actually went wrong. On this sitting, it is very difficult to say like this is like allergic reaction, something like that, because I prescribed 3 days before, right? And
Yeah,
he
doctor. Yeah.
and he's been taking this medication for last 3 days, right?
Yeah, doctor.
So after 3 days, he developed reaction for the same drugs. We need to confirm that. I'm not saying you are lying. Please don't get me wrong, but I need to confirm because usually if some patient has
Doctor, I'm afraid to bring
yes,
him here, doctor, because your chamber will be closed after half an hour, but it may take minimum 2 hours, doctor, to bring him here.
okay, in that case, what can we do? We can refer him. You can take him to the hospital in the emergency department. I can give a letter for the in this regards. What do you
What
say about that?
emergency department will do, doctor?
Yeah, emergency doctor in the hospital, they will assess the patient's conditions. If actually it's a drug reaction or something like that dangerous, they will treat your brother with an instance. Okay, but they will try to accept what actually try to figure out what actually went wrong. Then they advise him or treat
Okay.
him accordingly.
Okay, doctor, that's good. But one thing, doctor, I am also late today because your attendant stopped me, doctor, to see you early. I told him, I request him that my brother's situation is very, very bad now. But he said to me that maintain the queue, doctor. He's very naughty man outside, doctor. Why you keep
I
this
am
naughty person, doctor, there?
I am really sorry for this, and I understand your anger. I assure you, I will talk to him about this, and I promise you, he will be better next time. Is it all right with you?
Will you kick him out, doctor, from here?
Well, I will talk to him regarding this. And
No,
I
doctor,
promise you,
tell
he
me,
will
doctor,
change
he's a
his
very, very
attitude.
bad man, doctor, outside. And because we are the patients, always we are seeing you here, my family members and others for the long time. But if you keep one person there, doctor, is very, very frustrating for us.
Yeah,
Why
I
don't you
understand.
call him here inside, doctor, in front of me? 2 minutes left. 2 minutes left.
Okay, doctor. Okay, Mr. Karim, I promise you, I will talk about this situation. But at right now, I think your brother is our prime concern. We should think about him. I will take this matter separately. I promise you. Is it all right?
Okay, okay, doctor.
Okay, so Mr. Karim, do you have any other concerns or any other queries regarding your brother?
No, doctor, I told you that my brother may be dying and you are also sending my brother to the emergency doctor. Is there any reason there's something to be very emergency, doctor?
Well, I appreciate your concern as you told me that your brother last night developed some rashes. Yes. So we
Yes.
need to evaluate the cause. Why this happening? Is it some dangerous condition or for other condition? Sitting in the GP center, I cannot say what went wrong exactly because I haven't seen the patient now. And you also mentioned that your brother fever subsided, some symptoms subsided. So it's very unusual
So
for
you think that,
that.
doctor, something serious? Otherwise, why you are sending to the emergency department, doctor? I become
Well,
more frustrated now.
I understand. I appreciate your concern. Actually, it could be, I cannot say like this, to actually whatever I make this decision to the best interest of your brother. So that as his life is precious to us, I know you love your brother, he's precious to me also. So we
Okay,
don't
okay, doctor.
want
I
to
will
take
I will
any
go
chances.
there, doctor. Okay, I will go there, doctor. I will go
Oh,
there.
okay, you can go there. If you need any help from me, just let me know. I will do my best.
How can I get you, doctor?
Okay, I'll give you the contact number of our department. Okay, you
Okay,
can
doctor. Okay, doctor.
send an
Okay, thank you,
SMS.
doctor. Time up. Thank you very much.
Thank you.
Dr. Faisal, thank you very much for your practice with me, and I enjoyed with you a lot, but definitely have something to say. And I think our colleagues, those who listen to us, they can say something also. I expect from them. And
I practice about the PACES scenario. You
I
understand?
understood you. Possibly you're the anyway.
I
We have
don't
to
even
think.
know if GP always offer the contact number or not.
The choosing of the word was an issue for you. I understand.
Yeah.
Anyway, what about our colleagues are thinking about this? Did anybody observe fully and to say something here? There's something done wrong by Dr. Faisal here? Anyone? All the things are good.
I really appreciate that he did very well, according to me.
Okay, you can give him the pass mark and everything, but something to be bad is a matter of learning here.
Yeah, yes.
So what thing actually happened wrong to you in the performance? You can criticize only the examiner, only the candidate, not the surrogate, because surrogate is not the matter of passing or fail in the exam. Don't comment about the surrogate today.
Sir, as
Dr. Fauzia, welcome, please.
yes, sir, Dr. Faisal has explored that his brother was fine, means his symptoms have been resolved and there is no other complaint like other than rashes. So I think it's a matter of reassurance, not to send to the emergency. He
That
can
means
say like
you
this,
talk
as there
about
is no
the
other.
decision-making issue for further treatment. Okay. Is it, Dr. Fauzia, that the what I say exploration of the patient status is not completed? Completed means the rash is not very dangerous thing. Is there any problem of the vital signs? So how to explore the vital signs? Patient is not here, patient at home. Dr. Fauzia, can you give the answer?
Yes, so if the patient is doing all the things right, means he's sleeping well and he's eating, and there is, so we can assess
Only
that.
one question, Dr. Fauzia, only one question other than sitting, eating, doing, washing. Only one question Dr. Faisal can ask to the brother, Mr. Karim. Dr. Faisal also can share here. Dr. Faisal, be connected, please, as you are the volunteer. Don't
Yes.
leave the session.
Any
I
loss of
think
consciousness?
could be, or rather only simply asking about the breathlessness.
I asked the breathlessness, shortness of breath.
Sorry, Doctor, possibly I skipped it. I'm sorry.
I asked the.
Yes,
asked about the
Dr. Faisal has
shortness of
asked.
breath.
Yes.
Thank you, doctor. If you
Yes.
could, maybe I skipped somehow. So if they are breathless, this is enough. What Dr. Fauzi is telling that many things, but only one question, what Dr. Faisal asked, that the breathless is enough. So situation is not very bad, but Dr. Faisal sending to the emergency, this is worrisome. But how to tackle the situation now as a GP? Dr. Faisal, as he is oriented more in the PACES for that, intention is going there. But if as a GP, the condition is not very bad, it is a patient understanding. Patient or patient relatives understanding that situation is very bad. Now, patient offered that I like to see you maybe after 2 hours. Your time is over. What you will do, Dr. Fauzi, as a GP? Or anyone?
Oh,
Actually, what
just
GP
ask
should do?
in the concern of the patient, ask means as your brother is fine, as you are saying that your brother is fine, and for me it's not seem to be so much serious, and you can send a picture of your brother's rashes means on WhatsApp to me or like this.
No. Thing is that as a GP, as I mentioned you, the today's scenario mainly is for the general practitioners, for OSCE candidates, that GP can stay for the patient 1 or 2 hours more, if possible. And in the GP center, there not be a rotational GP one after another. Reliever may not be there. So what would be better? Better that, okay, it is just gentle approach that, okay, I will be waiting for you. 2 hours will be no matter for me. It will be more soothing, more encouraging. What Dr. Faisal say now? What do you think?
Yes, because I don't know about the GPs and we always practice the hospital.
So those who are the GP now today here, they learned from your mistake. Sorry to say. Okay.
No, it's good. Mistake is good thing. You should
And in
not
our
mistake in the
practice
exam.
also, suppose
Yeah,
those who will be the what will the specialist in the South Asian perspective, all are GP. All are GP in your chamber, in the evening practice chamber, right? So everybody should be family physician like. Okay, so this is one thing. Second thing, it is called the ongoing support. What was not evident there, ongoing support means that when patient will go to even the emergency, then the brother Mr. Karim telling that how I can get you. So actually there is an office number is very good approach, that better not to give any personal number. But for the time being, for emergency situation, if I offer my personal number, no problem. Or you can tell that the office number is there, immediately you can call them, I will get you in the way, no problem. But you said that, okay, I will give you the office number, you will inform, but patient is going to the emergency. Rather, I have to be proactive. Proactive means, okay, you go there, I will take the informations time to time from there, no worry. Because you are the GP, you know where the patient is to go. You are referring there. You know the contact of the hospital. So it will be that I will be very proactive. I think you understand, all of you. Proactive means the patient will not call me. Rather, I will call to the patient or the patient attendants. It will be a very positive approach. Okay. It's called ongoing support. Ongoing support. Any other observation from anyone? No more. Okay, Dr. Faisal. From the very beginning. No. I have to say something, Dr. Faisal. Huh?
Yeah.
If anybody add also in the meantime, you're welcome to add. Dr. Faisal, did you attend our Breaking Bad News station before? Maybe 2 or 3 days before?
No.
No? Okay, okay. There are two interesting stations throughout the world, not only in the OSCE, rather in the PACES exam also. One is the Breaking Bad News, second is Angry Patient Management, where our consultation technique is a little modified. I told you that listening quality a little modified here. There will be very, very passive listening, not active listening too much. Only have your seat. I am sorry for that. But Dr. Faisal, possibly you didn't say anytime have your seat. Maybe it is not very live session. You are not saying your patient. Usually person become angry means he is standing. You could say to make a practice, please, Mr. Kareem, have your seat. Okay, Dr. Faisal.
Okay.
There is a belief of some religious persons also, rather those who are the Muslims, in their religious learning. I'm just telling, irrespective of the religion and other, there is a tips that when a person become angry, let them sit to have their seat. If anger is still not combated, then what next? Who can say? Encourage to lie down on the bed. And there may be subsequent other things also. I don't like to go there. I'm just telling to inform you, to knock you that even in the belief also, this is very, very practical. Allow the person to sit down from the standing. It will combat some anger. Am I able to make you understand, Dr. Faisal?
Yes.
I think all of you understood. So from the standing, we allow the person or encourage the patient to have the sit. So in the exam hall, not important from the sit to the lie down, but this is your attitude be judged by the examiner that you are telling to have your sit. And when you are talking, the speed is like to talk to other patient. I don't know, other colleagues observed it not. The speed of talking that you are trying to explaining, but why not very gently and slowly? What we usually practice in our Breaking Bad News station. Suppose you are explaining like that, okay, it is very happening to this, is very rational, few percent is having, but why not in the little slow speed? Dr. Faisal, do you understand? For example, I am very sorry, Mr. Kareem. It may happen. It's very good medicine. The medicine is working, but something happened very wrong. Can you follow me, Dr. Faisal?
Yes, yes.
It will be very slow. And two stations like Breaking Bad News and this one is a station of performance, not the knowledge. Actually, it is not the test of knowledge too much. It is just your performance is being assessed here, how you acquired your attitude to your patient. So be slow, okay? So speed will be relatively slower than other station.
Okay.
So these two things I observed, and you said in the initial part, I appreciate your anger. How much useful the word to use word appreciate. Appreciate is very positive thing, right, doctor?
Yes.
So person become angry. Anger is not a good quality of human. Is not it?
Yes.
It is not the matter of appreciation. So what the better word will be here to be chosen? Can anybody say? I
can understand you are upset.
I acknowledge your anger, rather to say. Acknowledge. In my sense, it is a better word. Acknowledge, not appreciate. Not appreciate. Okay?
Okay.
Okay. And nothing, you said that nothing intentional. You use that okay, I didn't give medicine intentional is very, very right. But always, I need to feel very sorry it happened wrong. I will be with you, no problem. That means the positive attitude will be very important here, that from the beginning, I was with the patient, up to the ending also, I will be with the patient. We have to show it in our performance.
Okay.
Okay, doctor. So these are few things only I observed to share with you, and other colleagues also understood that You have done very well. And as a mentor, I like to say something bad so that we can correct ourselves. For that, I added something to you.
Yeah.
Any query in your mind, Dr. Faisal, now?
No. As a patient say he developed rash last day, he start antibiotic 3 days before. So it's obviously not the drug reaction, right?
It could be drug reaction. Why not? 2 days after it may happen, doctor. Not that immediately it will happen. It's a very minor drug side effect. It is not anaphylactic reaction.
Anaphylactic reaction. Yeah.
It is not anaphylactic reaction. Already you said that you asked about the shortness of breath. Nothing there.
Yeah.
Okay. So actually, the intention will be that I like to see my patient. And there are some GP qualities, doctor. As you are thinking about this patient, is like me also, I'm practicing medicine now, especially. But I feel better in the GP. I said in my introductory talk that the GP has different ways of communicating to the patient, not by looking directly. Over telephone, you can take care of your patient. Okay, you can take in your chamber. Understand? Nowadays, the social medias, WhatsApp and other many things, many ways of contacting to the patient. So we can utilize it. In the last few days, though not with you and my native colleagues hearing me, that I was talking about the qualities of the consultation. On that day, I said that the telephonic consultation will not be too much encouraging. Actually, it can create some confusion. I told in my country perspective that in this, especially in the South Asian people, telephonic consultation is not up to the mark. So I discouraged it. Yeah. But actually, GP is to develop the skill of telephonic consultation. And every day you are receiving some phone call from your friend or relatives that this is brother, and then what can I do now? What can I do now? So without being skilled, you may do some mistake. And many experience also here. The examples are there in our society. By giving the telephone consultation, actually patient become bad, worse than usual. It happened. So anyway, it is not the issues today. And up to these anger management, if nobody having any query further, we can switch now.
Sir,
yeah, Dr. Farhad here, maybe. Yeah, please.
Yeah. Sir, I would like to ask you something that the patient is asking many times that why you are sending my patient in emergency. Yeah. In that case, how should we proceed? How to explain him that why we should send him to the emergency?
There was an intention from the surrogate. Actually, yeah. I can remember I was also became more speedy. I couldn't control my speed also. I criticize myself now. When Dr. Faisal was speedy, surrogate became speedy.
Exactly.
So, the thing is that the consultation control should be in the hand of candidate, not to the surrogate. Okay? One thing. Okay. If you make speedy consultation, surrogate will be more speedy. This is the thing, concept of consultation. Second thing, what Dr. Farhad said. I can remember surrogate asking 2 or 3 times, why you're sending me to the emergency? This is a technique of surrogation, means that possibly that doctor decision is wrong here. Okay?
Yeah.
First time you answered, okay, I'm sending the emergency. Again, surrogate is not being convinced. Why, doctor? Is there anything serious or other? It means that doctor is thinking maybe I'm wrong. But if you're confident to justify, to send there, you can explain that, okay, if something serious could be there, what I can't understand now, for that is better to be there. Dr. Farhad, you got the answer?
Yes, sir.
Justify something. Justify
I mentioned
something.
to observe the patient and assess,
You are very right. You are very right. You are very right. But actually, your decision was not too much perfect, as patient does not have any problem. You could manage your patient from your chamber, maybe 2 hours. You can wait there. You can see the patient. You can give only antihistamine tablet and assure. You can check the vital signs. Patient might not go to the emergency. Not needed there also. So there are some issues of decision making, right or left. But I like to inform you, when surrogate actually ask 2 or 3 times same question, you need to realize that there might be some confusion of the decision. Okay. Any further thing? My beloved colleague, already I shared our links, especially for the OSCE group, those who didn't join till now for those. In the last class also I have done it. Already somebody might be joining now for our WhatsApp and the Telegram to be updated more. And now this is video already you have seen maybe in the meantime. And our YouTube also, doctor, if you want to see our many videos there, for example, angry patient, the breaking bad news, you can see it there. And for you, I like to post here also. You can copy from here, or you know from the group most of the time. So it will be useful. And today at the end, it's my pleasure that many of you join our session today, and especially those who are appearing in the coming OSCE. So you are invited to be with us if you feel better with us. And I like to share one thing for examinee, that the preparation will not be for the OSCE actually, that the not only to know about the system and the cases, you need to know the case categories we discussed before also. The different case strategy will be different. So you need to practice in this way. And this is our invitation to all of you doctors before. From day after tomorrow, we are going to start for the Chennai candidate, the system-wise practice session. If you don't have any query and further thing, I hope we can conclude now. And thank you very much for your kind attention and participation. And later on, somebody requested me to do the angry patient management in future. Maybe we will be busy in few days with the OSCE preparation for some doctors, those who registered with us. But even then, we will be serious to arrange. If any topic in your mind, doctor, you can say in the group, especially in the WhatsApp group, we'll consider. And in future, from our side, we are planning to arrange one session for the telephonic consultation. And this telephonic consultation is in the last time exam, maybe in the PACES. And one colleague with us, she actually scored 100%. And we had a meeting with her, and she said that she had a case of telephonic consultation. Actually, I can remember the telephonic consultation is the extraordinary quality of the GP, but the PACES exam now absorbed it. So it's very interesting. So keep your eyes in the group for the update. Even then, any other issues, if you think better to be discussed or practice, you feel free to share with us, doctor. And thank you very much. Thank you very much. See you.